Hello, hello, hello. Happy Tuesday. Happy Tuesday, my ATHLers. How are you all doing? My name is Abby Tyler. I am a practicing nurse, family nurse practitioner, content creator, a community health volunteer, and I also contribute to other forums as well as health as a health contributor. As evident by tonight, I'm going to be streaming live on Focus on Liberia. So welcome to all my new followers and welcome to all the members from Focus on Liberia. Thanks for joining me. Just going to be 2 seconds here. Let me just share the show, and you out there, please share it on your various pages and different form. I would appreciate if you do that. So I'm just going to share this to one more, and then we will be good to go. Okay, so 1 second here. Again, like I always start with how's the weather in your neighborhood? My neck of the woods, it was like really hot today. I work in the city, so it's like much hotter in the city than it is outside of the city. But any kind of weather, as long as it's nice and warm, I'm fine with it. So, okay, so I'm going to go here and that's it. And let me open up my notes. Okay, here. Okay, so today I'm going to be talking about, you see there, the topic is uh, how to keep your health, your eyes healthy, your beautiful eyes healthy. Over the years, there's been so many different phrases about how beautiful your eyes are. You know, the song, Whitney Houston song, "If you say my eyes are beautiful, that's because they're looking at you." The other one, where in a sea of many a thousand people, my eyes will always search for you. And of course, if you're in my generation and you watch Debbie Gibson, I think you heard the song "In Your Eyes," I Get Lost in Your Eyes. That like one of my favorite songs from back in the day. I'm dating myself now, but there's so many things that have been set up by your eyes. And we talk a lot about different health issues and all. We talk about hypertension, which is high blood pressure. We talk about diabetes. We talk about kidney disease and so many other things. But most of the time, we don't talk that much about eye health. I'm not an ophthalmologist, I'm not an optometrist, but I also talk about different health issues with my patients and the public. So important, that's also your vision and making sure your vision's okay. So, as always, my disclaimer, whatever I say here shouldn't take the place of you seeing your provider first and making sure you're following up with your provider for your own personal care. Okay, so let's get into the program. Okay, so I'm just going to read something. I got this wonderful article and then I put my notes and everything with it. So, healthy eyes and good visions are important for the quality of life. But even though you may think that your eyes are bad defined and there's nothing going on with them, you still need to have an annual visit with your eye doctor to make sure that your eyes are seen. And also, they by looking through your eyes, they can also detect other diseases too. So not just poor vision, but there are many other diseases that come along with that. Okay, so let's start with issues that affect your eyes. All right, go in here. Some of these should affect your eye. Proper nutrition. Okay, your eyes rely on vitamins and nutrients to protect against blinding eye diseases such as macular degeneration, glaucoma. Exposure. So eye damages can also result from ultraviolet light, radiation from the sun, as well as toxic chemicals, exposures at home and or on the job. That's why most people who work in different factories and all are supposed to have their goggles on and different things that you do that's going to be exposing your eyes. Smoking, tobacco can increase the risk of several eye conditions that can lead to blindness as well. And health conditions such as diabetes. I've always talked about that. Diabetes is like one of the leading causes of adult blindness. So you want to make sure you're following up with that. And other issues increase the risk of your eye disease and vision loss. You may be predisposed to some of these diseases, but lifestyle choices can also help. So trauma, let's say if you're in a car accident before or anything that result of some kind of serious risk of disease of that, all that. So any kind of trauma, anything, an injury to the body that cause your eye problem, any vision loss or vision impairment. Infections, let's say if you had like conjunctivitis, bacterial conjunctivitis, or eye diseases that were not addressed or not properly treated, that can also have long-term effect. And things that are non-modifiable, like your family history. If your family have history of certain diseases, eye diseases, chances are more than likely you are at higher risk of getting those diseases. Things like Fuchs disease, FUCHS, that can run in families through generations. Sometimes it skips a generation, and that can also lead to blindness as well. So those are the diseases that when you go see your family, you're supposed to be seeing your eye doctor every year when you see a family doctor, we look at your eyes and we see what we don't do like a thorough examination as you would do if you go see the eye doctor. So we do that and we tell you follow up with your eye doctor every year. And if you have certain kind of diseases, the eye doctor might say come every, every 6 months or every 3 months or so, and then they follow up with their okay advancing age. That's something you cannot help. So age related macular degeneration, cataracts, glaucoma, low vision, and dry eyes, for example, can develop as you get older. So those are the things that when you usually people say, okay, when I'm in my 60s and 70s, that's when I'm going to go. No, usually you want to start going as soon as from the time you're old enough to see anyways. So you'll be seeing, of course, from birth, but usually from childhood and then go every year and then follow up. And especially as you get older, usually we start losing a little bit of our eyesight and everything around age 35 to 40. So it's not an old person disease. Okay. Why do you need an annual exam? So you're supposed to schedule an eye exam every year. Is important to protect your eyes. In addition, eyes provide hints of your overall health. Like I said, where they can section your eyes, they can look in your eyes, and they can find different diseases like muscular dystrophy, other things, MS, and all that can be seen through the examination through your eyes. So here are top 3 reasons why you should schedule an appointment to see your eye doctor. Now, the optometrist is the one that can do your regular examination, like when they put your eyes and put the pressure in your eyes, and then they go in there and put the eye drops in your eyes, and then they expose the eyes, and you go in there and they flash it and all and see everything. I'm not an eye doctor, so I can go give you the specifics. But the ophthalmologist, because people say, what's the difference between an ophthalmologist and optometrist? The ophthalmologist is the one that can do surgery. So let's say if you had to have cataract surgery, if you had a retina detachment or anything that has to do surgery, well, you can see both. But that's the ophthalmologist is the one that does the surgical part. The optometrist can do minor surgeries, but the ophthalmologist is the one that does major surgery. Okay, so the top 3 reasons that you need to go see the eye doctor, to test your visual acuity. So they check your eyes and make sure you're seeing okay for your age group, and want to make sure that okay, because usually perfect eye that's like 20/20, but of course they're going to check to make sure that the eye, your visual acuity is okay for your age group and what everything else based on your medical history. So that's also important that when if you hurt yourself and all, let's say if something hit your eye and you say, okay, my eye's hurting. The minute if you start seeing that you cannot see, go to the doctor, to the emergency right away. Do not go to your doctor's office. Go to the emergency room right away, because if anything happens to you, the first thing we do is check your visual acuity to make sure that you can see properly. Okay. So and sometimes you want to go see them, because let's say if you're wearing glasses, and some people have their glasses and they don't go see the doctors for like years. So you always have to go back at least annually so they can check your prescription to make sure that it wasn't overcorrected or undercorrected, or sometimes lack of correction at all. And if you're not wearing any glasses, you still need to go see so they can see, make sure that like again, like you can see perfectly clear for your age group and based on your medical history as well. All right. To check for eye disease. Again, many serious eye disease that have no symptoms. Okay. For example, cataract can develop over time and they develop very slowly, and you can't see that to the naked eye. So the doctor can be checking on that and making sure everything is okay as you gradually age. And if there's any problems there and you start having vision changes because of cataracts and different things, they can see that they can be detected way ahead of time, as opposed to waiting so late and then you have to have surgery. Okay. This all one, and also to reveal developmental problems too for children. Okay, uncorrected vision and problems in children can often cause leading, learning and reading disabilities, difficulties, contribute to other medical issues such as dyslexia, attention deficit disorder. Because if the child cannot see, or they're seeing letters are twisted back and forth, and you're thinking there, especially when you come from certain cultures where they don't have issues about how do you go about, you say, okay, well, this child just doesn't want to learn. Oh, well, this one is just dull. Oh, this one doesn't sit down quietly and read what it's supposed to do, and they're all over the place. But chances are maybe they can see properly and they need to get checked. So all those different developmental and behavior issues, you can go back. You can go back to the source. Of course, ruling out everything else too, and then making sure taking that part out and say, you know what, maybe there's something going on. Let's take them there. And sometimes people complain of like, itchy eyes, especially children, itchy eyes. They might say, can I sit up to can I sit up front in class so I can see the desk? Or usually, and I'm having headaches when I come home every day and I don't feel like I can see clearly, or having problems and my eyes get dry so easily. Those are kind of symptoms you want to be getting. When you watch them, when you looking at them and they're reading, and you see them squinting or moving the book back and forth like that to be able to see better, you say, maybe I need to go take them to the pediatrician. And then also the pediatrician will recommend you send again to see the eye doctor. Okay, again, it's supposed to be seeing an eye doctor from very early age, and then they have diabetes, type 1 diabetes. From the time they're little, they're supposed to be seeing an eye doctor even more and more frequently than like annually. Okay. So make sure your eye doctor is aware of your complete medical history and family history. Use your yearly checkup and as an opportunity to provide updated information. So if anything happened, if you saw the eye doctor last year and you had something change in your medical history, you can go back there again and say, okay, they will actually, has anything changed in your medical history? Make sure you bring that to attention. Oh, I found out my mother's got glaucoma, or found my brother had cataracts, or had other issues going on. That can be added. Again, like I always say, your personal history and then your family history doesn't necessarily mean that you're going to get what the family got, but it's part of your genetic history. So it just means that you have a higher risk of getting that same disease. Doesn't mean you're necessarily going to get it, but if I didn't have that in my history and you had that in your history, doesn't mean I'm not going to get it, but you're at a higher risk of getting it. Okay. So let me just take a drink of water here for a second, and then I'll. Okay. So anyway, just a little break. I'm just going to check the comment right here, so I'm not doing this. So let's see here. Okay, so I'm going to go here. Okay, so let's do that. Okay, so what are some of the common eye conditions? So the most common, these are one where your lenses, the lens in the eyes and all that too, they call them refractive diseases. But and usually the symptoms is like typically you have blurred visions, also have headaches and eye straining, and you again, like I said, you find them squinting. So nearsighted, you can see things near, you can see things that's too far away. I know most of my family had their glasses on, and after a while, I used to say if I can take the needle and I can thread the needle, and then if I can do it by myself, I'm fine. That means my eyes are okay. One time I was threading the needle, and I was so proud of myself, and I went to thread the needle, and literally the needle was like over here, and the thread was all the way over here, and I was like, oh my goodness, don't tell me I have to go get tested. That's like old people stuff. Even though like everybody in my family was wearing glasses, but then also when I started reading and farsighted, nearsighted, it's like I can see everything over there. Farsighted, I can see everything across. I can see the stop sign, but anything that's close to me, then I have to do it like that. When you start doing that to see things a little clarity, you be like, oh, okay, it's time to get checked. So you nearsighted and farsighted. Now I'm like both nearsighted and farsighted, because when I went to get my glasses, they're like, and I wanted to get on those cute little sexy glasses, and they said, nope, you have to cover your whole lens because you have to be able to see right here and be able to see over there. So it's like bifocals, but it's not the bifocals from back in the day that used to be like really glaring here. So I have to wear glasses that cover my entire eyes. But when I'm out, I don't really necessarily have to wear it unless if I have to read or see something, close enough to me, but I can see things far away. Okay, so you want to make sure you do that. So some of those diseases, nearsighted, farsighted, presbyopia is like when that's when your lenses are over the years as age, it causes like some problem with nearsighted and farsighted. And the stigmatism is like the eyes, you mismatch lenses and all that too. So it's important. Most of these things you can tell, and you're just thinking that, oh, maybe I'm just tired. Maybe my eyes are just tired. I'm not getting enough sleep and all that. Maybe that's what's causing this problem. But go and get checked every year. Okay. Again, like I said, there's certain diseases that you can see through the naked eye and they form over the years, and you don't want to get to the point where is you have to have surgery or it may affect your life and livelihood. Now, when I say over the years and getting older, people might be thinking, oh yeah, this is like 70 to 80-year-old people getting that. You could be getting that in your 30s and 40s. Okay. So other conditions also, like I say, age related macular degeneration, where you stop seeing everything and then you only see to the sides. You can see right here. That definitely would lead to loss of your job, and eventually leads to vision loss. So, and those things you can't tell until you go to your doctor when you start seeing symptoms, but you won't know the intensity of it until you go see your eye doctor. Okay, you may have cataracts again. Those are the things that come on very slowly, and you start complaining. I can see certain things, and it has like a milky film over your eyes. Sometimes you can see that as it, and when you see that, usually that means like really far advanced when you can see the like the milky thing over the eye. Again, you want to get your eyes checked long enough so you can get that. And glaucoma is the damage to your nerve neither. So it's like usually from the heavy pressure in the eyes, and it's one of those things where you can never, it's called, the other name for it is called sneak thief of sight, because you wouldn't know until when you go get your eyes checked or you start complaining of pain and all that. That's when they say, oh, you have glaucoma, and then they have to do, either they put you in some eye drops, or sometimes they have to do corrective surgery too. Dry eye syndrome, that can happen at any age. Some people, there was a time when my eyes were really dry, and it's like in the morning, and then do after the afternoon I always have to put eye drops in. So now I have to put eye drops in the morning, and sometimes I put ointment in my eyes at night to keep my lenses and everything from, to get it, keep it like nice and moist so it doesn't dry up, because I spend so much time, I mean, I take care of my patients, so I'm spending so much time watching, looking at the computer, looking at this. When I come home, I'm looking at patients' charts. So every time I'm looking at the computer, or I'm looking at my phone screen. And now in the kind of day and age that we're in, everybody's watching, looking at the screen for the longest of time, especially the younger kids. And I see my son sometimes when he's looking down, I'm like, please don't. First of all, you're putting strain on your neck, and then you're just doing that. So you're training your eyes to look like that. That can cause damage later on. When they're younger, of course, they think they're invincible, nothing will happen, and that is not safe. Okay, so I was like, no, put it down for a little bit. And of course, yeah, and children and youngsters, I said, put your phone down so you can rest, and then they get on the computer. I was like, you're still doing the same thing, but at least the computer is wider so they can look away. And then I also say, make sure the computer is far away from your face, that you not have that right in your face like that, because at least we're older. We didn't have computers right away from the time we had it, but like up to age 18, age 19, 20, it wasn't like 24/7 in our faces. So at least we have that. But now that we're getting older, we still have to look at the computer. Just about every job, you have to spend time looking at the computer. So it's important that you have to give your eyes a rest every once in a while. Okay, let me see here. So take a comment here. Yep. You used to think it was tiredness diagnosed. Yep. Yep. First I saw it. Yep. It comes like you think you have so many different symptoms, and you think, oh man, maybe I didn't get enough sleep last night. Oh, and so go just the same way you go get your heart check, your lung check, and all that. Get your eye check, because it's your sight. People say your eyes are the windows of your soul. So all the romantic thing they talk about eyesight and all is that important. Okay, when you take it around, the romantic part is part of your health. And again, it can detect different diseases too. Okay, so conjunctivitis, making sure if you have conjunctivitis, when you're younger, make sure you know how easily transmissible it is. So keep your hands from your eyes. If anybody else has it in the house, stay far, far, far away from them to make sure that you're not going to get it. And if you get it, if you feel like you're getting it, if it's in one eye, even it will cross over to the other eye. So call the eye doctor and get your antibiotics right away. Okay, stay away from home, stay away from school, and stay away from other people until you can get your eyes checked. All right. And floaters. Sometimes you see there's a called floaters, like you see something just going in the air, and you can see that, and you're thinking, okay, maybe if I close my eyes, so you close your eyes, you can literally see it floating back and forth. If that's happening, you want to make sure you bring that to your doctor's attention. And again, like I said, usually MS. Okay, when you go when usually my friend, that's how she was diagnosed, that she had MS. Okay, multiple sclerosis, that's the weakening when the body, your body has all these, it sends all these messages to your brain for you to move your arm, to move your legs, to move different part of your body. Over time, if you have MS, what happens, it stops sending the signals, and the corrective, the sheet and correction, sorry, everything that's covering the myelin sheet and all that, that's supposed to be sending a message, that's supposed to keep it together and send a message to your brain for you to be able to move everything. It starts loosening up, it starts clearing up, and you no longer get the messages anymore. And eventually it's like neurological disease, and over time it can devastate, it's like life changing, because you can no longer move your arms, you become paralyzed. Most people get diagnosed in like the 18 age, maybe young, 20s to 40s, and over time you do become handicapped, and you have to like rely on care, your family and all. It also affects your heart. People have heart, so So I'm not trying to scare anybody, but I'm just saying those are things where if you're checking your eyes and all, if you get diagnosed early, you can start treatment early and you can really delay all the complications that come with MS. Okay, so all of that is important to get your eyes checked. Okay, and so what are some of the tips to maintain your eyes? So getting your annual eye, remember when they go in there to put the little dot of fluid in your eye, dilated, and the eye doctor looks in there, make sure they check and make sure everything is okay. All right. I remember the last time I went to get my eyes checked, it was during COVID, and we had to do everything online before going in. And I mistakenly, I think I put my birthday for like, I would have been like 98, 99. And they're like, and I got in there, they're like, who are you? I said, oh, I'm Abigail Tyler. They're like, are you sure? I'm like, yeah. They said, oh, so good. They said, we told you like some 98-year-old person. Did you not see your birthday? I'm like, oh my God, I'm so sorry. So, when I was like, so there's during COVID where everything was so crazy. And I said, I need to get my eyes checked. And I broke my lens. And I woke up in the morning. I'm like, oh my God, something must be going on with me. And I didn't realize that my lens was like on the floor. So it's important when you get your glasses, always try to get two pairs. If your insurance covers it, try to get two pairs. So at least you have another one. Looking, I called my friend. I'm like, oh my God, I look like I had to put like tape on it until I got my eye. I said, oh my God, I look like Steve Urkel, African cousin. Because I was like sitting there like, oh my God, I need to see it. I needed to see. I was, of course, because like I said, I need to see it to read. So some of the ways you can help your eyes. Okay, enjoy a diet rich in variety of fruits and vegetables. Always fruits and vegetable. Carrots is really rich in vitamin A. Leafy greens. So for those Liberian people, you eat your cassava leaf and your potato greens, but make sure it's healthy because you want to make sure everything else is there. Okay, but most of these things like not the way we cook it completely. So try to get some lettuce and everything in there too. So that's not cooked. So at least you're eating something green and leafy and it still has all the nutrients. All right, eat a lot of food in salmon and tuna because it has the omega-3 fatty acids. So food, diet rich in seafood. You want to do that. Okay. Wear sunglasses that block out the UVA rays and all that. So I know some people's like, oh, I don't have to buy expensive glasses to make myself look good. But as long as it has, usually when it have the little label when you buy it, it would tell you what it blocks out, and you invest in like a decent pair of glasses and something that you keep safe so it's not breaking all over the place. And if you need to carry your regular ones, you can just carry your regular ones around. Okay. If you smoke or quit smoking, and if you ever don't start smoking, because all of that can affect the eyes. If you smoke, 100 quit now. You can also ask your doctor to get that. So there's so many resources out there. 100 quit now. We have the gum, we have the nicotine patch, we have so many different ways of helping you quit, because remember now, just smoking causes so many other diseases too. It's not just with the eye, but we're talking about the eyes today. Okay, maintain a healthy weight. If you're overweight, try to lose weight. Again, like I always said, I'm not talking against people who are overweight. I'm clinically overweight myself. I already had this conversation 2 weeks ago, but it's important to keep a healthy weight. Stay active, act 30 minutes a day, 3 times a week, or more, dancing, going for a brisk walk, doing upper and lower body exercise to stay healthy. Okay. Get the recommended amount. I already talked about it. Exercise. Use protective eyewear for sports, especially if you play sports. Make sure you're using goggles to cover your eyes to protect your eyes, because you don't want any injury that may cause problems later on in life. Make sure if you wear glasses or contact lenses, making sure you clean them the way they're supposed to be cleaned, especially contact lenses. Okay, because anything that affects the contact lens will affect your eyes. So don't just put your things anywhere. Don't let other people touch on it. Again, and cleaning the way the manufacturer recommends. Also, makeup. Do not share makeup with anybody else. People say I'm sharing this with my daughter, or I'm sharing it with my friend, or I'm sharing, I want to go visit somebody, and no, she wants to act like she's all big and bad. She cannot use my makeup, or she can't use my makeup brush and all. Don't do it. Even if you have your own brushes, and you're going to put it in the powder or put it wherever, that person's already used their brush and everything to put it back and forth, back and forth. So whatever infection that person may have had, that was and they probably didn't change their thing at it during the time, that can come onto you too. So you don't want any major infection can cause blindness. So don't use eye makeup. And if you do have infection, let's say if you had conjunctivitis, which is pink eye, make sure that after you're all healed and everything, throw all the brushes away or sanitize them. And I would suggest like the makeup that you're using. So for people who like to wear really expensive makeup and all, if you may have to throw away, because you're just going to be reinfecting yourself again. Okay, so just throw it out. If you have any kind of eye infection, throw it out, start all over. They do tell you to throw your to change your brushes every 3 months, anyways. And also, if you have makeup 3 to 6 months, get rid of it and get something else because you want to protect your eyes. Your eyes, I mean, you need your sight. Okay, so and work also if you have diabetes. Again, if you have diabetes, you want to work with your healthcare provider. Want to so maintain your A1C. Again, like I said, 4.8 to 5.6. That's no diabetes. Anything over 5.6, then you go into the pre-diabetic stages. And then if you continue, I'm talking about type 2 diabetes now. If you continue, your A1C hits 6.4, you are fully diabetic. Diabetes is one of the leading causes of blindness. I told you that before. You're talking about hypertension, you're talking about everything else. So you want to make sure that if you keep an A1C, if you're diabetic already, and you try to keep an A1C 7 and below, at least that way it's not releasing all that sugar and glucose in your body that can affect your eyesight. Okay. So you do that and take a break. This is a new thing now. Take a break from when you're looking at screen time. I have on my phone where it tells me how long I was on the phone for every day too. So it tells me that sometimes I'm like, yeah, okay, mind your business. But it's one of those things. We live in a world where we have to be on the screen. But this new thing now, it says that remember the 20-20-20 rule, where every 20 minutes you look away for 20 and look away at least 20 feet for at least 20 seconds. So it's the 20-20-20 rule. You every 20 minutes, you look away for at least 20 feet away and for 20 seconds. So you basically away from that, looking straight ahead for somewhere you think at least 20 feet for 20 seconds, and you do that. And sometimes you may just have to just shut it down and that's just like this minimum. So if you don't have to be in a computer, if you don't have to be on the screen, all that, to shut it down and just enjoy yourself and just enjoy your eyes. Because you notice when you're on the computer or you're on the phone more, you start getting headaches. You start feeling, I mean, the strain from your eyes because your eyes are supposed to focus this way and you causing them to just look down like that. So if you're on the phone, if you have to do this, you just have to be like your near side and far side and and just do that. Okay. So it shouldn't be like this. And then people like that and back and forth, back and forth. That is not safe. You got to keep your pretty eyes so you can keep on looking at your man or start looking at your woman or make sure you're looking sexy for whoever you're trying to attract. I'm just saying. Okay. So, anyways, so, it's the most important thing. So, to conclude, do what you can to support your eye, commit to regular eye exam. Again, like I said, every year you want to go every year. You might not think that anything is wrong, but you want to, at least you want to be better safe than sorry. Okay. Again, like I said, there are many symptoms as many eye diseases that show no symptoms whatsoever. So you want to go there. And if for children, your children are younger, making sure they see the eye doctor. The little eye exam that we do at the pediatrician's office, that's not enough. You literally have to take them to the eye doctor and get checked because again, it can lead to relearning and reading difficulties, headaches, and things where other people might just see as behavior issues and maybe just be something that can easily be corrected just by getting sorry. And for I think for also for eye different eye associations in America where they collect your old eyeglasses too and they can fix it and also donate it to people overseas. So if you have glasses somewhere you can go to your I think Vision Works and other place have I go to Vision Works, so that's why I'm calling that. Just call and just say I have a lot of old eyeglasses and I want to see if I can donate it to anybody. So at least you'll be helping be getting your eyes checked and also helping somebody. Okay, so I'm going to read some of the comments over here. Oh, color by lot here. Let me see. Oh wow. Hey Glendy, how are you? Oh, I have to come on. I think you're having your 1 year anniversary and stuff there, right? Let me just go in here and see. I'll see. Now I have to wait. You see me doing that. I'm looking at something small. I have dry eye symptoms and I use eye drops. You just mentioned using ointment at night. Is this the ointment over the counter? Speak to your doctor first, though, because there's so many different types. But yeah, the one I got was over the counter, but they recommended the ones I'm supposed to wear that I'm supposed to use. So make sure you speak to them first. Like in the I don't give specific health information because again, I don't know your medical history, but speak to them. Usually it's something over the counter and they tell you like the consistency. So they come a little differently, but just run it by your eye doctor and see, or run it by your family doctor. They can give you information about that too. Okay. I think Olaba said, yep. Okay. So I did that. And Make use of that insurance money. Yes, especially, and I mean, when I was at my other job, and when they say, "Oh, you have this insurance," oh, they were like, "You can get that." I mean, it's like it was like you can pick anything because we had such good insurance at the time for my eye. I was like, okay, yeah, you can get that, you can get this, you can get. I mean, and also they had the one with transition light lenses too, where as soon as you go out, it gets darker, so you can protect your eyes. I did that. I had that before, but then I was like, I don't like the way it looks like really ugly sunshades when I go out. I want to wear the sexy sunshades. So now I have to take off my glasses and put the sunshades on when I do, but I don't like the way it looks. Okay, so I said, nah, nah, nah. So I have my regular glasses and then I have my sunshades. So again, luckily for me, I don't have to keep it on when I'm going out and doing regular stuff. I put it on when I'm reading. I don't really need it when I'm driving either. So far, knock on wood, I'm okay. Alrighty. So Patricia Sayel says it because the eyes are dried upon waking up after sleeping with their air conditioning or watching TV. Yes, yeah, watching TV. Usually, what I do first thing, and also I used to forget to put my eye drops in, and then at about 2 to 3 o'clock in the day, my eyes are burning in pain. I mean, literally burning in pain. That I used to, if I'm on the floor seeing a patient, I literally had to like leave and go put my eye drops in. Or when I'm driving and I'm driving somewhere far, and you're straining, you're looking and all that. One time I was driving a highway, I literally had to pull over and all that. You know how dangerous that can be, but I had to pull over because I couldn't see and had to put my eye drops in. So what I do, I had these little capsules like the refresh eye drops. I had it in my car also. You have to make sure it's like stored where it's supposed to be kept nice and cool. And when I wake up in the morning, as soon as I go into the bathroom, brush my teeth and everything, I take my medicine, I do my eye drops right away. So I kind of had a routine because I wasn't used to taking medicine and all that. And I'm one of those people, even though I have healthcare, I have to like be really compliant with my medicine. I take vitamins and all. So I make sure I do my eye drops. I wash my face and everything, eye drops. And I always remember if I have to put the makeup on, I have to put my eye drops on first because if I do my eye drops and then go dab my eye, the eyeliner comes off. So I know that. Wash your eyes, do everything, eye drops always. And I always have an extra bottle with me in my bag, and I also have like in my bathroom, so if I happen to be somewhere and something happened, I can just put that in. But I had the one that lasts for like 12 hours, so I do that in the morning, I do it in the evening, and then also like I said, if I need to put my ointment on, I put it on too, especially if my eyes are like really dry at night, I do that. Okay, so okay, and she said smooch is juicy. Yes, I have healthy eating. I'm trying to get. I can't do the juicing thing yet. I guess I need to just buckle up and just bite the bullet and do it. But I have I went and bought all the different bottles and all the different sizes and all. Oh, and I just like, oh yes, I'm gonna do my juicing. I see people on Facebook and they're showing up with that juice and stuff. I'm gonna do it, and then I can't. I'll probably do it if somebody did it for me. But me, I'm more like eating like fresh fruits and vegetables and all that. So I like force myself to make sure I'm eating like at least 3 apples a day and try to eat food and see and food like my meal high in seafood. We do a lot of try to stay away from anything that's salty. We do a lot of fish broil and all that. Okay, and do the best you can. Patricia says, "Say it. Thank you." And who is that? Douglas Fangalo. What are you? What are you talking in, Baz? What? That's my natural voice. See, Doug, whatever. Go away. Go away. That is my natural voice. Have you never heard my natural voice before? And plus, when I had COVID earlier this year, my voice gets a little hoarse when I talk. So I'm still recovering from one of those people who have like long term COVID stuff. But that's my natural voice. I don't sit here and be all you're living in England and you don't even have the English accent. You've been there since like 1912. Anyways, love you, Doug. So let me see. Sam says my right eye experiencing slight pain and run tears when I read for long, 2 to 3 hours. Why? Well, because you're straining your eyes. And if you're having pain in your eyes, I strongly advise that you go and make an appointment to see an ophthalmologist because you're not supposed to be having pain in your eyes. It's different if your eyes are just dry. It would be painful if it become really dry. So again, try the artificial tears. That's like when you can get that over the counter. Okay, so call your doc and tell them I need to get artificial tears to keep my eyes and keep your eyes moisturized as much as possible. Do it in the morning. The Visine, don't use Visine because it used to be Visine before, but they're saying the Visine kind of dries the eyes, and that was this big thing against Visine. So I just say do it, and especially during the summer months and also during the spring season People have allergy eyes. That's me. You see me certain times, and my eyes are so dry or they're so watery. So look at like over the counter for allergy eyes, eye drops, and put that on before you go outside. Do it before you go outside. Don't do it after the fact. But that means you're chasing the symptoms. So do it before you go out. Okay, but it's important that you go and see your eye doctor first. At least get your baseline assessment, see where you are, making sure that you're not developing something that's going to cause you any kind of problems later. And then also you want to make sure that you're not out there and you're getting something like a glaucoma, cataracts, all those things, especially if you're young, that can affect your livelihood and and your life and all. And you need to be able to see carefully. And also remember your children too, make sure that they're going to see the eye doctor as much as recommended. Okay, so I'm like up to the 35-minute mark. So for all of you who I think I got to all the comments and all. So thank you all for watching. Thank you all for watching. I am really trying to get to at least 1,000 followers by the end of July. So for all of you who are watching, please share the show. Please invite other people to join. I talk about healthcare, I talk about lifestyle, I talk about different things. And I also come on Tuesday. For those of you who have family members or friends who don't frequent Facebook, I'm also on YouTube under the same name, Abby Tyler's Healthy Living, so you can go there. Also, even if you do follow me here, can you please just go on YouTube and just subscribe and hit follow? And on here, if you're following, you hit and if you really like this video, please hit the like button, comment, questions, anything. I do respond to comments later on if I don't get the chance to comment on here or respond to you during the live broadcast. Okay. So thank you all for joining me. For those of you who joined me for the first time tonight, I say thank you. And I'm sure like the numbers increased because I was on another forum, but I thank you all. I thank you all for watching. Stay healthy, stay safe, and get your eyes checked. Okay. And like I said, I don't know if the vision works all over the country, but that's where I go and it seemed to be okay. But it's different. There's so many different ones. And also in Walmart. So if you're in Walmart and you're getting your groceries and everything, you can just go right there and get your eyes checked. Okay. And again, optometrist is the one you can go to, and the ophthalmologist, you can also go there, but they're the ones that do both surgery. Eat healthy, stay healthy, drink a lot of fluid, lots and lots and lots of fluid. Of course, if you have other issues and all that. Okay, so thank you all for watching. I really appreciate it. Thank you all for your love and support. And I have an exciting show coming up on Thursday. Okay, we'll be talking about, we saw little Kim and her body, different stuff. And also we'll be talking about we'll be talking about that on Thursday. We'll be on Thursday at 7:00. Okay, so please join me in. And then of course, Friday, I do Friday chat with Abby. So thank you all for watching. And I have many other exciting shows for those of you who are here for the first time, many other exciting shows that you can go back and watch and ask me questions. And I'm always available to answer when I'm not too busy. Okay, so thank you all for watching. I really appreciate it. Take care. Good luck. Good night.